For now, the family and friends of hundreds of patients who died due to neglect in an English hospital are calling for criminal action to be taken against those responsible. An official report last week found that many people had died needlessly. Let's talk more about this scandal over the state of the British healthcare to RT's Sarah Firth, standing by live for us now in London. Sarah, it's good to see you. Thanks for coming on. Can you bring us up to date here? What is the latest edge to this scandal then?
OK, well, in the latest twist, we've seen an NHS whistleblower come out and say that he was forced to quit after he'd raised concerns about issues that he said endangered patient safety. But this latest revelation comes on the back of the Francis report that we saw last week. Now, that was in looking into the scandal that had happened at Mid Staffordshire Hospital, where it's thought more than 1,000 patients could have died between 2005 and 2008 as a result of inhumane and degrading treatment. Now, it was an absolutely shocking story. RT were covering this very, very closely, and we can hear now from one of the relatives that we'd spoken to of a patient that had died at Mid Staffordshire.
I lost my wife in Stafford Hospital in September 2008. It was just a disaster. People shouting and crying, no staff available, couldn't find a nurse. The buzzer was left out of reach. I went in once and she was on the floor. She'd been there since breakfast time.
Evil, that's the only word I can describe. They were nasty. My mum died in the most horrible circumstances that no human being should have to go through what she went through.
Well, of course, that's incredibly disturbing, and I think a lot of the relatives of the patients who died, a lot of the people who are campaigning very, very hard for what had been happening at Mid Staffordshire to be revealed and to be investigated, if not breathed a sigh of relief, were perhaps relieved when the Francis report came out, that at least now something was being done and that something would be looked into. But of course, the nasty shocks just seem to keep on coming. And as we said, this latest twist is the NHS whistleblower. He says that he was confronted with many of the same decisions and concerns that were raised at Mid Staffordshire Hospital. Now, he was the head of one of the hospitals, United Lincolnshire Hospital, and now this is one of 9 hospitals that are now being investigated on the back of the revelations of Mid Staffordshire. So that's obviously deeply concerning that he was facing many of the same problems. He claims that government targets that he refused to meet for fear that it would endanger patient safety meant that he then had to quit and was subject to a so-called super gag to keep him quiet and to keep these revelations from coming out. Now, the health authority denies this, but of course, it's just the latest in a series of revelations about failings within the NHS and, again, causing huge concern.
But, Sarah, if indeed these allegations, as far as I understand, some of these allegations and these fatal consequences are going back 4 years at least, why is it only now that all of these things are starting to come to light?
Absolutely, Rory. I mean, I think this is a real concern. As we said, the relatives of people who've died whilst in NHS care have been campaigning very, very hard to have some of these scandals made public. But it does seem that this has been going on for a long, long time. The whistleblower who's spoken out, Gary Walker, talked of a culture of fear and oppression. And certainly it seems that a lot of these problems have been going on for many, many years. Now, I'm joined by the head, one of the members of the NHA political party. Now, you're a political party that's been formed of people within the healthcare profession and that are all very concerned about what's happening in the NHS right now. When the Mid Staffordshire scandal was revealed, very much the rhetoric from the government was that this was an exceptional case, that this was, if not a one-off, it was particularly bad. And yet we're seeing 9 other hospitals being investigated, and it seems the nasty shocks just keep on coming. Are you surprised at this?
No, I'm not surprised at this. While Staffordshire was particularly bad, There have always been in the NHS, while most of the care has been fantastic over the years, in such a complicated organisation and such a large organisation, there will be such incidents, and there have been for many years. The real problem is that the NHS and the government do not seem to be able to learn from all the inquiries that have been. From 30 years ago, the Hospital Advisory Service would report, and I think the same things are still going on now.
Okay, when it comes to the Francis report, I mean, how much can we expect from this then? Because it's come out, you know, perhaps some relief for the families, but yet it seems that there's all this other stuff that's, you know, now being exposed. How much more do we not know about?
Well, I don't think that, I think that there will be other cases, but it's only to be expected. I don't think they'll be as bad as at Stafford. But the problem is, as I say, that we don't know yet how to avoid these in the future, and the government doesn't know, and that has got to be one of the main focuses of all our efforts, people who work in the NHS and all of us in the community, to find out how to prevent these sorts of things going on. The pressures on the NHS have always been there, and I think that over the last 20 years have got worse, and therefore you have the situation with the chief executive having to choose a totally make an unacceptable choice.
Yeah, and that's really a focus here right now at the moment as well, Rory, is that a lot of people, certainly relatives of people who've died, people who've been campaigning, have been very much calling for their head of the NHS who presided over the NHS whilst this was going on. He is still in his job. They've been calling for him to resign, but as yet he's resisted those calls.